Hello, I am TJ Summers. I'm going to talk to you a little bit about HIV/AIDS, kind of like the historic outbreak of the epidemic. This right here will be a video to see. So looking at the overview, so HIV is human immunodeficient virus, and then it's actually what causes AIDS if it's left untreated, which is acquired immunodeficiency syndrome. HIV has been around since the 1800s. In Central Africa, passed from chimps to human through infected blood from the meat of chimps. And then currently there's not a cure. However, there are medications out there that can help you live longer and protect their partners. The affected locations, so in America at the very beginning, it was San Francisco and New York City, New York. Then it started in Africa. It was passed from chimpanzees to humans, and then it eventually made its way to the United States. Currently, there's a decrease in northern and central. However, it is worldwide, global. So just highlighting some bits from the timeline with HIV/AIDS. Again, as it goes, it starts all the way from the 80s to present day. So in the 80s, 1980 to be specific, in 1981 where they had the first reported case. However, they called it pneumonia. They didn't call it AIDS or HIV. You're not going to see it called AIDS until September 24th, 1982, where the CDC coins the term AIDS, and that's when they released their first definition. So there's a big gap from whenever it first hit to then. And then some of the other highlights is like they see in 1982 blood transfusion, then you see labor and delivery, and then you go down to some of the safeguards for national blood supplies in 1985 to 1989. Coming more on the present side, that's whenever they start going to release medications for management. Then you have guidelines released for prevent infections in 1995 to the 1999. So big long timeline here of AIDS. So looking at some of the epidemiological context, so transmission, it's going to be transmitted through blood, semen, pre-semen fluid, rectal fluid, vaginal fluid, and breast milk. It must be from somebody who is HIV positive. It's going to get into your bloodstream through a mucous membrane, or an open cut or sore, or direct injection. Typically, it's passed through vaginal sex, anal sex with someone with HIV, without a condom, sharing a needle, other drug equipment, the labor and delivery process, through pregnancy with somebody who's HIV positive, breastfeeding, even exposure to needle sticks. There are some rare occasions, however, those are very rare, very less common. And then risk factors is going to be condomless anal or vaginal sex, having an STI, harmful use of drug and alcohol, limiting your decision-making skills, sharing contaminated needles, blood transfusions, things like that. Looking at incubation periods for HIV, it's 1 to 6 weeks, with the median being 3 weeks after exposure. Age, you're looking more like 10 years after infection, so a big long window there. And then the population, you're going to be, it's going to be like gay, bisexual, or men having sex with other men. Black, African American, Hispanic, Latino were more affected by AIDS and HIV. Transgender women who have sex with men are at a higher category. And then again, drug use is another So some of the surveillance methods used. So AIDS reporting started in 1981. In 1986, all 50 states and districts of Columbia implemented AIDS case reporting. In 1985, states began case reporting. So they're required to report any AIDS cases or HIV cases. As of 2008, all states implemented confidential name-based HIV infection reporting. In 2013, CDC begins referring to AIDS as HIV infection stage 3. AIDS is all HIV surveillance, or AIDS and all HIV surveillance. Then today, we're collecting demographic information, transmission category, initial immunity status. So some of the outbreak investigation continued. Some key steps taken in investigating the outbreak. So in identifying the disease, in 1979, LA documented, so Los Angeles documented HIV before the apparent outbreak. Sorry, I lost my voice there. In June 1981, first case of what would be known as AIDS is identified. Again, AIDS, the name AIDS came later on. They thought it was a form of pneumonia, or that's what they were calling it. The U.S. CDC establishes term AIDS referred to 4 identified risk factors. And then in 1983, CDC identifies all major routes of transmission. So this is kind of a long process. Today we'll talk a little bit more about like today's epidemics here in a little bit. So some of the challenges that investigators faced is the initial reports claimed it was PCP, which is the pneumonia. And then there's a lot of physical and time restraints assigned to the task force because, again, whenever this began, there was only 30 investigators assigned to the task force, and it's a big country. So early on in the epidemic, these diseases received very little attention until more people became more sick beyond the gay community. There's a lot of stigma related to this, and there still is a lot of stigma related to this. So, again, one of the challenges they faced was stigma. So that could be something as simple as somebody not wanting to be associated with it so they don't get tested and so on. It can be they are positive and they have received a lot of stigma-related hate and they're ashamed of it or whatever. So again, there's a lot of challenges that these early investigators faced early on. So the spread of this, so again, some of the transmission routes is anal, vaginal sex with someone who is HIV positive without using a condom, or medicine to prevent or treat HIV. So again, there is a medication that you can take that can help prevent it. It can even help treat HIV, but again, you can't cure it. So sharing needles, syringes, and other drug equipment with someone who is positive with HIV. And then again, during pregnancy, labor, delivery, and breastfeeding is another way. And while you're not taking anti-HIV drugs. So some of the affected population group, so like I pointed out earlier with the Black African American, they have a 42.1% per 100,000 people. And then the Hispanic Latino is 21.7% of 100,000 people. And then persons with multiple race is 18.4. So the male to female ratio, males are more prone with 21 per 100,000. And then male to male sexual contact is 66% overall, and then 81% among males. Female heterosexual contact is 83%, and then injected drugs is following it with 8%. So some of the rates and social impact. So so these are kind of what it was early on compared to now. That's what we're looking at with that's why there's two numbers for these. So for morbidity, 85.6 million have become infected as of the start of the epidemic, where 39 million are living with HIV in 2022. So for mortality rates, 40.4 million have died as of the start. So it's the start to the end And then in just 2022 alone, 6,030 have died. So touching base on some of the impacts, you're going to look at society. So it's going to weaken social support systems. You're going to see a decrease in participation in formal education among younger populations. Think because parents can't go to work because they are too sick to work. Kids might be picking up jobs. There's going to be stigma and discrimination along with this. So food insecurity, living in poverty because parents can't go to work because they're too sick. Healthcare, you're going to see poor disease management. You're going to see effective decision making. You're going to see cultural competency. Again, this is a population that's highly stigmatized and discriminated against just because of typically the transmission situation with that. Disclosure of health information due to fear of discrimination. Again, they are constantly stigmatized and discriminated against. It makes it really hard to pass any information along in regards to that. And then economy in general, so it can lead to poverty because you can't work because you're so sick. And then depleting family income due to loss of work. So some of the control measures is going to be some new guidelines were made for healthcare workers. Those were like the early on where I said that they were fearful of treating patients with HIV/AIDS. There's a lot of new campaigns to encourage people to make healthy choices, and then access to HIV/AIDS testing. That's a big important one. There's a lot of so for effectiveness, even with this information, testing, and procedures, it's still prominent today and still have newly infected individuals. Ethical, there's some standards of care issues with HIV, mainly due to stigma, discrimination, privacy, and confidentiality of their infection, and then discuss challenges encountered. There are some issues associated with drug use, sharing needles, sexual preference that puts you in a higher risk category. So some lessons learned from the response effort. Excellent surveillance lead to excellent outcomes. You have to have surveillance to process information, get the information out there, research, rapid identification. So as soon as you can identify what it is, you can start research on how to prevent, how to stop, how to cure. Testing blood for potential infectious diseases. So blood testing to make sure you're not passing blood to blood during transfusions. Wearing gloves when touching potential infectious diseases. So that's your universal procedures, which is actually created for the AIDS HIV epidemic because people didn't know what procedures to follow. Proper disposure of needles. Importance of scientific evidence of modes of transmission, prevention, and treatment. Science must guide these decisions. And then science evidence isn't enough. You must fight stigma and gain community involvement. To have a successful anything, you really have to get community involvement. And you're going to always fight stigma. Stigma is always going to be there. I feel like especially today, there's a lot of discrimination and stigma, even something that is highly scientific based. So fight probably isn't the best word. You have to find a very positive way of getting community involvement and really getting everybody on board with procedures. So comparison to modern practice, first historical outbreaks to current outbreaks. So stigmatization among those with the disease. So that still exists today. You looked at that with COVID. You looked at that with HIV/AIDS. You could use that with really any outbreak. Use of outline set, creating a definition, trying to configure a method of transmission. So really trying to get that information out there quick. You want that definition. You want those methods. You want the transmission. You need that information quick. Following, creating, and changing emergency plan for infectious disease. So I feel like every time we've had any type of disease or virus or anything, some emergency plan stuff changes. They have to, you have a playbook, but sometimes you have to change it to fit the current need. So in contrast, today we definitely have faster testing. We have better surveillance. We have more resources that we can use. We have a quicker response to everything. We have greater access regarding communication. Back in the 80s, you couldn't. It was a little bit harder to see what's going on the other side of the world. Then disease being detected relatively quickly. So, again, it took several years to even classify it as AIDS. It was pneumonia for the longest time. The evolution. So, we've had, again, increased surveillance, getting quicker, getting the definition out there, create vaccinations for prevention of new diseases, quicker creation of definition, quicker detection, and increased stigma and false information. Right. So some of the conclusions and lessons. So in summary, I'm just going to read you this a little bit because I thought it broke it down pretty quick. HIV/AIDS is still around today. However, there have still been strides being made for managing the disease. Early detection and treatment lead to better outcomes. There's still no cure. However, there's medication out there for to help manage. The epidemic has helped us write emergency plans and responses to an infectious disease. Stigma and false information is dangerous and can lead to poor health outcomes. We still see that today. There needs to be an importance placed on surveillance, investigation, distribution of quick and accurate information, and then health outcomes of those with disadvantaged backgrounds are more at risk of infectious diseases. I feel like that's one of the ones that you can almost put the nail on the board there. That's always going to be a case. We need to do better at working with a lot of the disadvantaged groups and really address some of the disparities that put them more at risk. So key lessons, again, importance of surveillance, importance of continued research for future prevention. So that could be even like testing, because I know we do testing on diseases to find anything. Getting definitions out quick and early to really slow the spread, or maybe even stop the spread. Early release of transmission. So, is it airborne? Is it mouth to mouth? Is it contact? You got to get that information out there, because you have a situation where, like in the early 80s, you see somebody in the room, it's pneumonia. You're like, oh, what am I supposed to do? We're not for sure. So future public health challenges. There's always going to be stigma. We have to figure out a way to resolve stigma, and really, there's got to be a way. We see stigma back then. We still see stigma today. So drug resistance disease. So their medication that we use today, like antivirals, are becoming, some of the viruses and whatnot are becoming drug resistant. So that's something that that's going to be a challenge for the future. So future healthcare system, there's been an increase in issues found in the healthcare system. Not to poke at them, but we saw during AIDS some of it, and then we saw during COVID how hospital systems, they didn't necessarily fail, but they were overcrowded and really struggling to stay afloat, and a lot of them went into debt. Some of them probably even closed. And then false information about the disease. There's false information about AIDS, about how it was passed, who was more affected, and then today there's false information about, and we're constantly fighting some of the stigma and discrimination, false information. Even science today is not enough, so to say, which is sad. And then these are some of my resources here. Thank you for listening.